Have you ever stopped for a moment after swallowing your blood pressure pill and asked yourself a simple question? Do I really understand what this medicine is doing inside my body every single day? Most people never ask that question. They trust the prescription. They trust the label on the bottle. They trust that because they've been taking the medication for months or even years, everything must be fine. But that confidence can sometimes become dangerous, because medications like Amlodipine, Losartan, and Lisinopril are not ordinary pills. They don't simply lower a number on a blood pressure monitor. Every day they influence how your heart works. They change the way your blood vessels behave. They affect how your kidneys regulate fluids and minerals. And while these medicines have helped millions of people live longer, healthier lives, they also require something many patients never receive: clear, practical knowledge about how they work, what warning signs deserve attention, and when a seemingly harmless symptom should never be ignored. In my experience, even highly educated people often know surprisingly little about the medications they take every morning. They know the name, they know the dosage, but they don't know how to recognize the body's early signals when something changes. That is exactly why today's discussion matters. My goal is simple. By the time you finish this video, you'll understand these 3 commonly prescribed blood pressure medications in a completely different way. Not with confusing medical terminology. Not with complicated textbook explanations, but with practical knowledge you can actually use to protect your health and have more meaningful conversations with your doctor. And I want to begin with the story of someone I'll call Walter. His experience illustrates a lesson that every person taking blood pressure medication should understand. Walter was 74 years old. Before retirement, he had worked as an engineer, and his personality reflected that background perfectly. He was organized, careful, methodical. If his physician prescribed a medication, Walter followed the instructions exactly as written. He never skipped doses. He never guessed. His daughter even prepared a weekly pill organizer with each day carefully labeled, and Walter treated that organizer almost like a project schedule. Everything had its place. Everything happened on time. So when his physician decided to add amlodipine to help improve his blood pressure control, Walter assumed it was simply another medicine serving the same purpose as the others. Different name, same job, nothing more to think about. That assumption nearly changed the course of an entire year of his life. About 3 months after beginning the medication, Walter noticed something unusual. His shoes suddenly felt tighter than they used to. At first, he blamed aging. Then he wondered if he had simply been walking less. But week after week, the swelling became more noticeable. By late afternoon, his feet looked larger than normal. His socks left deep marks around his ankles. His legs felt unusually heavy, almost as if they were carrying extra weight with every step. Walking became uncomfortable. So without realizing it, he slowly began reducing his daily activity. Instead of taking his regular neighborhood walks, he stayed inside more often. Instead of enjoying errands, he looked for excuses to sit down. Eventually, he became frightened. He convinced himself that his circulation was failing. Then another thought entered his mind. What if this was heart failure? Like many people today, Walter searched the internet looking for answers. The information he found only increased his anxiety. Every symptom seemed to point towards something serious. Every article made him worry a little more. Yet the true explanation was far less frightening. More importantly, it was completely manageable. The problem wasn't that Walter had developed heart failure. The problem was that nobody had ever explained the differences between amlodipine, Losartan, and Lisinopril. Yes, all 3 medications are prescribed to lower blood pressure, but that is where their similarities largely end. Each belongs to a different family of medications. Each works through its own biological pathway. And each has its own predictable pattern of benefits and side effects. Understanding those differences changes the way you interpret what your body is trying to tell you. Amlodipine belongs to a class known as calcium channel blockers. Its primary role is to relax the smooth muscle inside your arteries. When those arteries become more relaxed, blood flows with less resistance. Your heart no longer has to push as hard to circulate blood throughout your body. As a result, blood pressure decreases. Lisinopril works in an entirely different way. It belongs to the ACE inhibitor family. Instead of directly relaxing the arteries, it blocks an enzyme responsible for producing a powerful substance that naturally causes blood vessels to tighten. When that enzyme is blocked, the blood vessels remain more open, allowing blood pressure to fall. Losartan also targets this same hormone system. However, rather than blocking the enzyme itself, it blocks the receptors where that hormone normally acts. It reaches the same destination by taking a different biological route. To many patients, these distinctions may sound minor. In reality, they matter tremendously, because different mechanisms create different side effects. Different side effects require different responses, and different warning signs deserve different levels of concern. Once Walter's physician recognized what was happening, everything became much clearer. His swollen legs were not evidence of failing circulation. They were not proof that his heart was weakening. Instead, they reflected one of the most well-known effects of amlodipine. The medication relaxes arteries much more effectively than veins. That small difference changes how fluid moves through the tiny blood vessels in the legs. As pressure builds within those vessels, some fluid naturally moves into the surrounding tissues. The result is swelling around the ankles and feet. Once the medication was adjusted and the situation managed appropriately, Walter gradually returned to his normal routine. Within just a few weeks, he was comfortably wearing his regular walking shoes again. His confidence returned. His daily walks resumed. Most importantly, his fear disappeared because he finally understood what had actually been happening inside his body. And that's one of the most valuable lessons I hope you take away today. The name printed on your prescription bottle is much more than just a label. It tells an important story about how that medication works. It predicts the kinds of side effects you may experience, and it helps explain the signals your body may send long before a serious problem develops. That understanding is one of the most powerful tools you can have as a patient. Now let's look more closely at that swelling, because it is one of the most misunderstood side effects associated with blood pressure medication, especially amlodipine. Many people immediately assume the worst. They think their heart is becoming weak. They worry their kidneys are beginning to fail. Some even convince themselves that their circulation is permanently damaged. In reality, the explanation is often much simpler. And once you understand the science behind it, the symptom becomes far less mysterious. Here's what is actually happening inside the body. Amlodipine relaxes the small arteries that carry blood toward the tissues in your legs. As those arteries widen, blood enters more easily. However, the veins responsible for carrying that blood back toward the heart do not relax to the same degree. That creates a small imbalance. More blood arrives than leaves efficiently. Pressure gradually builds inside the tiny blood vessels near the ankles and feet. Eventually, some of that pressure forces fluid through the vessel walls and into the surrounding tissue. What you notice is swelling. Your shoes begin to feel tighter. Your socks leave deeper marks than they used to. By the afternoon, your legs may feel heavier than they did earlier in the day. This isn't the same type of fluid retention that happens after eating an unusually salty meal. It isn't automatically a sign that your kidneys are failing, and in many cases, it has nothing to do with heart failure. It is often a predictable response to the way amlodipine performs its intended job. Understanding that difference is extremely important. But there's another issue that concerns me even more than the swelling itself. It's how people respond once they notice it. Some patients decide they know the solution. Without speaking to anyone, they simply stop taking their medication. For a few days, they feel relieved because the swelling slowly improves. Meanwhile, their blood pressure quietly begins climbing again. Since high blood pressure rarely causes immediate symptoms, they often believe everything is fine. Weeks or months later, they may be living with dangerously elevated blood pressure without realizing it. Other people react in exactly the opposite direction. They see swollen ankles and assume they're holding too much water, so they intentionally drink less. Unfortunately, dehydration is not the answer. Reducing fluid intake can actually create additional problems, especially for older adults already taking medications that influence blood pressure and kidney function. Then there are people like Walter. They simply tolerate the discomfort. They stop walking as much. They avoid activities they once enjoyed. They accept a lower quality of life because they assume nothing can be done. None of those responses is the right one. The best response is surprisingly simple. Talk with your physician. Swelling caused by amlodipine does not automatically mean the medication has failed. It doesn't necessarily mean you must stop taking it. Sometimes a small adjustment in timing makes a noticeable difference. Sometimes elevating the legs during the day helps reduce symptoms. In other situations, your physician may recommend combining medications differently or selecting another option that better matches your body's individual response. The important point is that solutions exist. But those solutions can only be explored if your healthcare team knows what you're experiencing. Suffering quietly helps no one. If you happen to take amlodipine yourself, I encourage you to think honestly about how your legs feel by the end of a typical day. Have your shoes become tighter? Do your ankles appear puffier than they used to? Have you dismissed those changes simply because you assumed they were a normal part of aging? You may discover that many other people have experienced exactly the same thing. Now let's shift our attention to Lisinopril and discuss perhaps its most recognized side effect, the cough. Not the type of cough that produces mucus, not the kind that accompanies a chest infection. Instead, it's usually a dry, persistent irritation that feels as though something is constantly tickling the back of your throat. It often becomes most noticeable at night. Many people find themselves clearing their throat repeatedly without relief. Cough drops don't solve it. Lozenges rarely help. Antihistamines usually make little difference. And because nothing seems to work, frustration slowly builds. What makes this side effect especially challenging is its timing. Unlike many medication reactions that appear within the first few days, this one can develop much later. Some patients notice it during the first week. Others remain symptom-free for months before the cough suddenly begins. By then, almost nobody suspects the medication. Instead, they blame seasonal allergies. They assume lingering irritation from a recent cold. Some think acid reflux has returned. Others believe dry indoor air is responsible. The medication rarely receives any suspicion at all. Let me introduce you to Evelyn. She was 71 years old and spent much of her free time gardening. Being outdoors brought her genuine happiness. When the cough first appeared during late spring, the explanation seemed obvious. Pollen, flowers, freshly cut grass. Everything pointed towards seasonal allergies. She purchased antihistamines. She invested in an air purifier. She tried every reasonable home remedy she could find. Nothing changed. Eventually, she mentioned the problem to her primary physician. A chest X-ray was ordered. Fortunately, the results were completely normal, yet the cough continued. Night after night, it interrupted her sleep. Day after day, it slowly drained her energy. She became increasingly tired, increasingly frustrated, and increasingly worried that an important diagnosis had somehow been overlooked. When she eventually came to see me, one of the very first questions I asked was surprisingly simple. When exactly did you begin taking Lisinopril? She paused, pulled out her phone, looked through her medication history, then she quietly started counting the months. She had started Lisinopril almost 11 months earlier. The cough had appeared roughly 4 months after treatment began. Until that moment, she had never connected the two events. Once we recognized that the medication was the most likely explanation, we worked together with her primary physician to transition her to Losartan. Losartan treats blood pressure through a similar hormonal pathway. However, it rarely causes this particular cough. Within about 2 weeks, the irritation completely disappeared. Think about that for a moment. Nearly a full year of interrupted sleep, months of unnecessary worry, countless attempts to solve a problem that had a surprisingly straightforward explanation, all because the connection had never been made. Before we continue, I need to emphasize one critical point that every person taking an ACE inhibitor should remember. A dry cough can certainly become annoying, but there is another symptom that belongs in an entirely different category. If you are taking Lisinopril and suddenly develop swelling of your lips, your tongue, your face, or your throat, especially if swallowing becomes difficult or your breathing feels restricted, you should never wait to see whether it improves. You should never postpone action until the next morning. You should never assume an allergy pill will solve the problem. Seek emergency medical care immediately. This condition is known as angioedema. Fortunately, it is uncommon. But despite being rare, it can become life-threatening because swelling inside the airway can progress much faster than many people expect. Remember this distinction carefully. A persistent dry cough is usually a side effect that deserves discussion with your doctor. Swelling involving the mouth or throat is an emergency that requires immediate medical attention. Knowing the difference could one day protect your life. Now let's turn our attention to Losartan, because it introduces a different kind of concern. What makes this situation especially interesting is that it often develops in people who are genuinely trying to make healthier choices. They're following good advice. They're improving their diet. They're making thoughtful decisions. Yet, without realizing it, those same decisions can sometimes create an unexpected problem. Losartan, much like lisinopril, works through the renin-angiotensin system, one of the body's primary systems for controlling blood pressure. Besides lowering blood pressure, these medications can also increase the amount of potassium circulating in your bloodstream. For most patients, this isn't a problem. With regular monitoring and healthy kidney function, potassium levels usually remain safely within the normal range. The concern arises when additional sources of potassium quietly enter the picture. This is where many people are caught by surprise. When you hear the word potassium, you probably think of bananas, maybe oranges, perhaps dietary supplements. But those aren't the only places potassium hides. One of the biggest hidden sources is something many supermarkets actively promote as a healthier alternative to regular table salt: salt substitutes. If you've walked through the grocery store recently, you've probably seen them sitting beside traditional salt. Many are labeled as heart-friendly or lower in sodium. At first glance, they appear to be an excellent choice for anyone trying to improve cardiovascular health. What many people don't realize is that these products often replace sodium with potassium chloride. That changes everything. Imagine an older adult who has been advised to reduce salt intake. Wanting to do the right thing, they purchase one of these salt substitutes. They begin sprinkling it generously over vegetables, soups, eggs, and nearly every meal they prepare. At the same time, they're faithfully taking Losartan every day. Without realizing it, both the medication and the salt substitute are increasing potassium exposure. Slowly, quietly, potassium levels can rise higher than intended. When potassium climbs too high, it begins affecting something far more important than muscles alone. It influences the electrical signals that allow your heart to beat normally. That's where the real concern begins. Unfortunately, high potassium doesn't always produce dramatic warning signs. Sometimes it develops almost silently. A person may simply notice unusual muscle weakness. They may feel exhausted despite sleeping well. Their legs may cramp more often than usual. Their hands may tingle unexpectedly. Some describe a strange fluttering sensation in the chest or an irregular heartbeat that comes and goes. And occasionally, there are almost no symptoms until the situation becomes much more serious. That silent progression is exactly why awareness matters. I want you to pause for a moment and think about someone close to you. Perhaps it's your spouse, a parent, a close friend. Or maybe you're thinking about yourself. Has anyone switched from regular salt to a salt substitute during the past couple of years? If that person also takes Losartan or Lisinopril, this is absolutely worth discussing with their physician. Not because these medications are unsafe, not because potassium-rich foods should suddenly be avoided, and certainly not because healthy eating is the problem. The concern is simply the combination. When multiple sources of potassium are added together without anyone recognizing it, the balance can gradually shift in a direction nobody intended. There are other hidden sources as well. Electrolyte powders, certain meal replacement drinks, sports recovery beverages available without a prescription. Many of these products contain meaningful amounts of potassium. Because they're sold over the counter, patients often don't even think to mention them during appointments. Yet from your body's perspective, every source counts. Sometimes the products people assume are harmless deserve just as much attention as prescription medications. Now I'd like to discuss a situation that I believe deserves much more attention than it usually receives. It doesn't involve changing medications. It doesn't require adding another prescription. Instead, it involves something almost everyone experiences sooner or later: getting sick. Not a hospitalization. Not a life-threatening illness. Just an ordinary stomach virus. Several days of vomiting. Persistent diarrhea. Poor appetite. A hot summer week with excessive sweating and not enough fluid intake. Situations like these may seem temporary, but they can completely change how blood pressure medications behave inside the body. When you're well hydrated, your physician carefully selects a medication dose based on how your body normally functions. But illness changes those conditions. As dehydration develops, your circulating blood volume decreases. Your kidneys receive less blood flow. Your blood pressure naturally becomes more vulnerable to dropping. Under those circumstances, the exact same dose of Losartan or Lisinopril that worked perfectly just a few days earlier may suddenly become much stronger than intended. The medication itself hasn't changed. Your body has. Blood pressure may fall too low. You may begin feeling dizzy whenever you stand. Weakness becomes more noticeable. Some people feel as though they might faint. Meanwhile, the kidneys, already under stress from dehydration, become even more vulnerable to injury. This is one of the most practical lessons I can share with anyone managing blood pressure. Illness changes the rules. When your body changes, your medication plan sometimes needs to change as well. That's why every patient should have what many physicians call a sick day plan. In other words, clear instructions about what to do if vomiting, diarrhea, or significant dehydration develops. Should you temporarily hold a dose? Should you continue taking everything exactly as prescribed? Which symptoms require a phone call? Which ones require urgent evaluation? These are questions that deserve answers before illness ever occurs. Unfortunately, many patients never receive that guidance. If your physician has never discussed this with you, consider asking a simple question during your next visit. What should I do with my blood pressure medication if I develop a stomach illness and can't keep food or fluids down? That single conversation could prevent serious complications later. It's one of the most valuable questions you can ask. Yet it's also one of the least commonly asked. Let me ask you something. Has your doctor ever given you specific instructions about managing your blood pressure medication during an illness? Think about it honestly. Many people realize the answer is no. And if that's the case, you're certainly not alone. Now let's imagine another situation that happens every single day. Your arthritis becomes more painful. Your knees ache after walking. Your lower back feels stiff. Like millions of people, you stop by the pharmacy and pick up a bottle of ibuprofen. Nothing unusual. No prescription required. It's something you've probably used for years. It feels completely routine. But now imagine you're also taking Lisinopril, or Losartan. Perhaps your physician has even prescribed a diuretic, a water pill, to help remove excess fluid. Individually, Each medication has an important purpose. Together, however, especially when combined with dehydration or regular use of anti-inflammatory pain relievers, they can significantly reduce blood flow to the kidneys. This isn't an extremely rare complication. In fact, it's one of the most preventable medication-related problems physicians encounter. The reason it happens so often is surprisingly simple. Most people don't think of over-the-counter medications as real medications. They think of them as something convenient for pain relief, something available to everyone, something that couldn't possibly interfere with prescription treatment. Your kidneys don't see it that way. They don't care whether a medication came from a prescription bottle or a store shelf. They respond only to chemistry. If the combination reduces blood flow enough, kidney function can suffer. That is why anyone regularly using ibuprofen, naproxen, or similar anti-inflammatory medications while taking blood pressure medicine should discuss safer options with their healthcare provider. Fortunately, alternatives often exist. Acetaminophen may be appropriate in certain situations. Topical pain-relieving treatments can sometimes reduce the need for oral medication. Physical therapy, stretching programs, strengthening exercises, heat therapy, or other personalized approaches may also provide meaningful relief. The goal isn't to leave you living with unnecessary pain. It's to find a solution that protects both your comfort and your long-term kidney health. The safest approach is almost always the one developed together with your physician rather than one created by trial and error at home. Now let's talk about something that seems small on the surface, but in older adults can quietly become one of the most important warning signs to pay attention to. Dizziness. That brief moment when you stand up from a chair or get out of bed too quickly and the room feels slightly unsteady. Maybe your vision softens for a second. Maybe you instinctively reach for support. And then, just as quickly, it passes. Most people dismiss it immediately. They tell themselves, "I stood up too fast." And in many cases, that explanation feels reasonable enough that they never mention it again. But when we look closer, especially in people taking blood pressure medications like Amlodipine, Losartan, or Lisinopril, this symptom deserves more attention than it usually gets. Because dizziness is not just a sensation, it is a signal. It reflects what is happening to blood flow when your body shifts position. When you stand, gravity pulls blood toward your lower body. Your cardiovascular system is supposed to respond instantly by tightening blood vessels and maintaining stable blood pressure to the brain. But blood pressure medications are designed to lower that pressure. So sometimes that natural adjustment becomes slightly delayed or slightly reduced. For a few seconds, less blood reaches the brain. That brief drop is what you feel as lightheadedness or imbalance. On its own, it may seem harmless. But in older adults, the consequences of even a few seconds of dizziness can be serious. A moment of unsteadiness can lead to a fall. A fall can lead to fractures. And a fracture, especially a hip fracture, can change a person's independence in ways that are very difficult to recover from. This is why dizziness should never be ignored when it becomes frequent or predictable. It is not about creating fear. It is about recognizing risk early enough to prevent harm. Fortunately, there are simple and effective ways to reduce it. One of the most practical strategies is how you change position. Instead of standing up quickly, pause for a moment after sitting. Let your body adjust. When getting out of bed, sit on the edge first. Take a few slow breaths. Then stand gradually. These small steps give your circulatory system time to respond. Hydration also plays an important role. Even mild dehydration can make dizziness more likely because blood volume is lower, which makes it harder for your body to maintain steady pressure when you change position. But perhaps the most important point is this. If dizziness continues regularly, or if it begins after starting or changing a medication, it should always be discussed with your physician. It may mean the dose is slightly too strong. It may mean a combination of medications needs to be adjusted. Or it may point to a simple lifestyle factor that can be corrected easily. The key is not to ignore it. Now let's move to something that creates confusion and unnecessary anxiety for many people managing blood pressure at home. Blood pressure readings. A single number taken at a random moment can feel extremely important. Sometimes it feels reassuring. Other times it feels alarming. But the truth is, blood pressure is not a fixed or constant number. It is dynamic. It changes throughout the day based on activity, stress, sleep, food, hydration, posture, and even emotions. If you take a reading after a poor night's sleep, it may be higher than usual. If you take it after drinking coffee or feeling anxious, it may rise temporarily. If you measure it after resting quietly, it may be lower. None of these single readings tells the full story. The real value comes from patterns over time. That is what physicians rely on when adjusting treatment. Not one reading, not one moment, but trends collected consistently. That is why consistency matters so much. The same arm should be used each time. The same time of day should be chosen whenever possible. You should be seated comfortably and resting quietly for several minutes before measuring. No talking, no rushing, no recent physical activity. When readings are taken in a consistent way, the results become far more meaningful. They stop being emotional triggers and start becoming useful medical data. Without that structure, people often fall into a cycle of reacting too quickly. One high reading leads to fear. That fear sometimes leads to extra medication doses. One low reading leads to skipping medication unnecessarily. And over time, this pattern creates instability rather than control. But when measurements are taken properly and reviewed over time, decisions become calmer and far more accurate. You and your doctor can see what is truly happening instead of reacting to isolated moments. That shift alone can significantly improve both safety and confidence. If you have been following along this far, you are already starting to see a pattern. These medications are not designed to be used reactively. They are not rescue treatments. They are long-term regulators. They work best when taken consistently, at stable doses, with a clear understanding of how the body responds over time. And when used that way, they can be extremely effective at reducing the long-term risks of uncontrolled blood pressure. Before we move forward, I want to repeat something important, because it often gets misunderstood. Blood pressure medications are not meant to be adjusted based on emotion or a single reading. They are meant to be guided by patterns, supported by medical advice, and adjusted thoughtfully when needed. That is how stability is achieved. And that is how risks are reduced over time. In the next part, we will continue building on these practical insights and look at additional situations where everyday habits and common medications can interact in ways most people never expect. Now let's bring everything together, because at this point, one message should be becoming very clear. Blood pressure medications like Amlodipine, Losartan, and Lisinopril are not simple background pills you take and forget. They are active regulators of your cardiovascular system. They shape how your blood vessels respond throughout the day. They influence how your kidneys manage fluid and electrolytes. And they only work safely when they are understood in the context of your entire body, your habits, and your daily life. One of the most important ideas to understand is that these medications are not rescue tools. They are not like painkillers that you take when something feels wrong. They are long-term control systems designed to keep your blood pressure stable over time. That stability only happens when the medication is taken consistently, not randomly adjusted based on fear or a single reading. Yet many people unintentionally disrupt that stability. They see one high reading and take extra medication. They see one low reading and skip a dose. They feel fine one day and assume they no longer need the pill. These reactions feel logical in the moment, but biologically, they create instability that can be more harmful than helpful. Your body responds best to consistency, not guessing, not reacting emotionally, but steady, predictable support. That is the foundation of safe blood pressure management. Now let's step back and reflect on something important. Throughout this discussion, we've seen how small, everyday decisions can quietly change how these medications behave. A salt substitute added to meals, a common painkiller taken for joint discomfort, a few days of dehydration during illness, a glass of water skipped during a busy day. None of these seem significant on their own, but when combined with blood pressure medication, they can meaningfully shift the balance inside your body. Sometimes that shift is harmless. Sometimes it creates symptoms that are misunderstood, and sometimes it increases risk without obvious warning signs. That is why awareness is not optional. It is protective. It allows you to recognize patterns early. It helps you avoid unnecessary fear, and it prevents small issues from turning into larger problems. There is another point that deserves equal attention. Many of the side effects we discussed today are not signs of failure. Swelling from amlodipine is not always heart disease. A cough from Lisinopril is not always lung illness. Mild dizziness is not automatically dangerous. These are often predictable responses to how the medication works. The danger comes when these signals are misinterpreted or ignored for too long, or when they are managed alone without guidance. That is why communication with your healthcare provider is not just helpful, it is essential. Because most of these situations have solutions. Sometimes it is a small adjustment in dose. Sometimes it is switching to a different medication in the same class. Sometimes it is changing timing or combining therapies more thoughtfully. And sometimes it is simply recognizing that what you are experiencing is known, manageable, and not as dangerous as it feels. But none of that happens in silence. It only happens when you speak up and share what your body is experiencing. Before we close, I want to return to the bigger picture. High blood pressure itself is often called a silent condition for a reason. It does not usually cause immediate symptoms, but over time, it increases risk for heart disease, stroke, kidney damage, and other serious complications. That is why these medications exist, not to create dependency, but to reduce long-term risk in a measurable, consistent way. When used correctly, they are among the most effective tools we have in modern medicine. But their safety depends on knowledge, knowing what is normal, knowing what deserves attention, and knowing when to ask for help. If there is one message to carry forward, it is this: your medication is not working in isolation. It is working inside a living system that changes every day based on what you eat, how you feel, how hydrated you are, and what other substances you introduce into your body. The more you understand that system, the safer you become. Not because you stop needing medical care, but because you become a better partner in it. Now, before you go, take a moment to think. Have you ever experienced any of the symptoms discussed in this video? Swelling in the legs? A persistent dry cough? Lightheadedness when standing? Or unexpected fatigue after small changes in routine? If so, those experiences are worth discussing, not ignoring. Because in most cases, the solution is not fear, it is adjustment. And adjustment only begins with awareness. If you found this breakdown helpful, stay connected, because there are many more important conversations to come about medications, aging, and everyday health decisions that quietly shape long-term well-being. Take care of your body. Understand what it is telling you, and never hesitate to bring those signals into a conversation with your doctor. That is how you stay safe. That is how you stay informed, and that is how you stay in control of your health.